Alrighty, here we go. Hello and thank you for watching this program on the best HCPCS codes. There's no audio taping or videotaping allowed, and any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. The information in this presentation is for educational purposes. It's not intended to be a substitute for your thorough clinical decision making and should not be construed as any written policy for any organization or federal agency. We don't provide legal services. If we discuss CPT codes, just a reminder, CPT is a registered trademark of the AMA. Every attempt has been made certain that the information in this presentation is 100% accurate. However, it's not guaranteed. Let me tell you a little bit about myself before we get started. My name is Dr. Marty Kotler. I am a chiropractor, practiced for 16 years, and then I started a company called Target Coding about 12 years ago. I became certified in CPT coding after I started my company, and I also am a certified professional compliance officer. That's what those letters are after my name, and I have to take certification courses and register for these certifications and take continuing education classes. My areas of expertise are in CPT coding, HIPAA compliance, documentation, compliant care plans, how to manage care, and Medicare. I've written many books and documentation training manuals on compliance and billing. I write articles for Chiropractic Economics and Dynamic Chiropractic. I'm a featured speaker for the Coding Institute, Parker Seminars, and for Foot Levelers. Plus, I'm a guest speaker at many state association conventions nationwide. And by the way, those of you that are part of your state association, if you're looking for a guest speaker on coding, compliance, and documentation, contact us. Maybe we could work something out. Could usually get a sponsor. My calendar is pretty filled for the next 6 to 9 months, but maybe we could work out something for next year. All right, let's go over the key points to begin with. HCPCS, you may have heard that term or seen those letters, HCPCS. That's an acronym. That stands for Healthcare Common Procedure Coding System. Healthcare Common Procedure Coding System. And these are codes. Now, the most popular codes are CPT codes. CPT stands for Current Procedural Terminology. And then we also have diagnosis codes, also known as ICD-10. ICD stands for International Classification of Diseases. We're up to the 10th revision or 10th edition. So when I hear coding, when somebody talks to me as a certified coder about coding, I think of three things. Right away, I think of CPT codes, ICD-10 codes, and HCPCS codes. HCPCS codes are not used that often. HCPCS codes are made up of 5-character alphanumeric codes, mainly representing supplies, durable medical equipment, non-physician services, and services not represented with CPT codes. HCPCS codes are revised quarterly based on input from the public, from providers, from manufacturers, vendors, specialty societies, and others. The clinical rationale for choosing a HCPCS code must be entered in the record. You have to have justification. You have to have a reason for recommending a supply, a device, an item. And it must be part of an overall plan of care. Now, certain HCPCS codes could be against your scope of practice. You might not be able to perform or sell some of these items. There could be some state restrictions. For example, in the state of Florida, if you do not get a home medical equipment license, you cannot dispense TENS devices to patients. That's for all healthcare practitioners in the state of Florida. So check with your scope of practice. Check with your state laws. Check with health insurance company. If you're going to bill an insurance company, contact them prior to billing. Contact your state board to make sure that whatever you plan on selling or incorporating regarding HCPCS codes are within your scope of practice, is within your scope of practice. So now I'm going to go through a whole bunch of examples here. Let's start off with A4450. This is non-waterproof tape. We're talking about kinesio tape. I get that question all the time, Dr. Kotler. How do I bill for kinesio tape? Well, the time spent doing the kinesio tape can be incorporated towards a time-based code like 97110 or 97112. Just kinesio tape in and of itself is not a billable service. So you could include the time as part of a timed therapeutic procedure code, plus you could also bill for the tape itself. So there you go. 4450 is non-waterproof, 4452 is waterproof per 18 square inches. Next, I mentioned tens. Okay, here we go, A4595. Those are the supplies that you may be able to bill and get paid for when you supply a patient with a TENS device. We're going to get into TENS machines in a few minutes. And then we have A9152, which is for single vitamins or mineral. A9153, multiple vitamins with or without minerals. Now, let me clarify this before we keep going. I am providing you with all these different types of HCPCS. They're going to they vary greatly for all different types of services and products that you could incorporate. Now, these codes don't necessarily mean an insurance company will pay for them. My recommendation, as I mentioned earlier, is if any of these items look interesting to you and you would like to incorporate them into your practice, again, first find out if it's within your scope to incorporate them. Let the patient know how much it's going to cost, just in case the insurance company doesn't pay for it. You want to call the insurance company to verify coverage prior. So we could look at it this way. Let's assume none of these are covered by insurance. That's okay too in my book, because many of these services you may want to charge cash. That's what many doctors tell me nowadays. Because of stricter rules on insurance, they want to go into more cash-based services. So you can look at all of these as cash-based services. You want to sell a patient a hot pack, a cold pack? There you go. A9273. Will an insurance company pay for it? Maybe. If not, tell the patient how much it's going to cost. A9300, exercise equipment. Maybe you want to incorporate the sale of gym balls or tubing, TheraBands, and sell those to patients. The patient wants to pay cash? Terrific. If they go, hey, can you give me a receipt? Can you give me something? I'd like to try and recoup the money that I just paid you from my insurance company. Well, there you go. Now you have a code, A9300. A999, some sort of miscellaneous DME where you cannot specify the specific type of product. I have a client in Wisconsin. He likes selling canes and crutches to patients. So we have E0100. That's a cane, adjustable with a fixed tip, adjustable or fixed tip. 105 is a quad or three-prong cane. Crutches, E0110. A walker. I had a client that patient came in and asked for a letter of medical necessity for a walker so the patient can get reimbursed by the insurance company. There you go, E0135. Any type of pillow, back cushion, cervical support pillow, E0190. I was pretty successful in getting insurance companies to pay for that code. How about mattresses? You see a lot of companies trying to sell chiropractors mattresses to then in turn sell them to patients. I've been able to help some of my clients get their patients reimbursed for mattresses. E0197, that's an air pressure mattress. E0198, that's a water pressure pad for mattress. E0199, dry pressure pad for a mattress. Again, you're giving it a shot. If the insurance company pays, great. If they don't, you understand these are cash-based services. Now, you may have to come up with a letter of medical necessity to get the item pre-authorized. So this was a letter I put together for one of my clients who said, hey, Dr. Kotler, I have a patient that bought one of these stand-up desks, like you may have seen these on TV. Varidesk, I think, is the name of the company, where you could have at your desk, you could stand, and it helps lift the computer screens and all the other devices you may have on your desk. It raises it and lowers it. So the patient asked for a letter of medical necessity to get reimbursed. So this was a sample letter, and we have quite a few sample letters of medical necessity for, desks and lumbar braces and mattresses and home traction units. So here's one example of a letter of medical necessity for a standing frame table desk, and there's a couple of codes there. E0638, that's for a standing frame table system, one position, and then E0641, standing frame table system for multi-position device. Okay, let's keep going. What else can you prescribe, sell to your patients? Heat lamps, electric heating pads, moist heating pads. Those of you that use hydrocollated steam packs, I use those in my practice. Patients would say, hey, I really like this. Where could I get it? Well, you can get it right here. It's $20, $30, and it was a nice way to get additional income without having to work too hard. Hydroculator unit, paraffin bath unit. And then we have TENS devices. There we go, E0720. That's a TENS device 2-lead. E0730, a TENS device 4 or more leads for nerve stimulation. So E0730, that's a very popular HCPCS code for TENS machines. Now, there are patients that come in with intractable back pain or neck pain, and you need to use a TENS machine. That's terrific. One of the insurance company typical requirements are the patient has to have chronic pain in order for a TENS device to be medically necessary. So what's the definition of chronic pain according to most insurance companies? The answer is 3 months of pain, and the patient may have tried other remedies like maybe physical therapy or acupuncture or over-the-counter pain medication. Nothing's working. The patient has had the pain for at least 3 months. Then a TENS machine would be indicated. Could be very profitable. TENS machines don't cost that much, yet they do pay pretty handsomely. And there's a biofeedback device, neuromuscular stimulator for scoliosis. And now we're going to get into some home use cervical traction codes. E0850, that's a traction stand, freestanding. E0855, cervical traction equipment not requiring additional stand or frame. E0856, cervical traction device with the inflatable air bladder. You may have seen that. Many of the chiropractic magazines and journals have a company that advertises those types of home cervical traction devices. E0856. E0860, traction equipment over the door. You may have seen those chin strap over the door with a bag of sand or bag of water on the other end, that little rope and pulley system. And then you have other companies that sell traction devices. Check with them to see what code they recommend. What else? Oh, here's a very common code that's used in many chiropractic offices. That is unattended electrical stimulation. Now, there is a CPT code for unattended electrical stim. That's 97014. That's nice. However, there are a few insurance companies like United Healthcare and Medicare secondaries that require the HCPCS code for unattended electrical stim. That's G0283. That's G0, not the letter O. It's the number 0, G0283. So United Healthcare, and those of you that see Medicare patients that have a secondary that may pick up the electrical stim, Medicare won't recognize 97014, so you need to use G0283. Now, I work with a few chiropractors. I'd say about 20% of the doctors that I work with have integrated practices where they may have a medical doctor, a physical therapist. So the practices that I work with that have a medical doctor, many of them do joint injections with a steroid. And there's one of the more common steroid injection codes, J2920. Now you could also put lidocaine in there. In my multi-specialty practice, we didn't use any type of prescription drug. With our trigger point injections, we use Trameal, which is a homeopathic remedy. And then we have some cervical collars, L0120. That's a foam cervical collar. Used to provide those to patients typically after a whiplash type auto accident. And there's L0140 for a semi-rigid plastic cervical collar, L0220, a thoracic rib belt. And then we have all these other types of orthotics. Now when you hear orthotic, many of you may think of foot levelers, a foot insert. Well, there are orthotics for other parts of the body. L0450, that's a thoracolumbar sacral orthotic. That provides trunk support to the upper thoracic region. And then we have sacroiliac orthotics, L0621. Sacroiliac orthosis, flexible. It provides pelvic sacral support, reduces motion in the sacroiliac joint, and the sacroiliac joint is one of the most commonly affected joints in the spine and the body. Many patients came into my practice with sacroiliac joint subluxations, misalignments, sprains, and strains. So that's a good diagnosis, like sacroiliitis, inflammation of the SI joint, or M9905, the subluxation of the SI joint, or something as simple as, here we go, sacroiliac sprain may require a sacroiliac belt. Sacroiliac sprain, the ICD-10 code is S33.6. So let's talk about justifying these diagnosis codes in order to provide the clinical rationale and the proof for, let's say, a sacroiliac brace. Let's talk about that for a minute. So Mr. Williams comes in and let's say he was standing on a ladder, changing a light bulb, falls off his ladder, hurts his back. He comes to your office and you diagnose a sacroiliac sprain. Now you may be questioned if you're submitting the claim to, let's say, an insurance company, and you get a call from the insurance company case reviewer or manager, case manager, and they say, hey, Dr. Kotler, you submitted a claim and for a sacroiliac belt with a diagnosis of sacroiliac sprain. Can you explain to me, how did you come up with that diagnosis? So hopefully you'll have a good answer like this. Well, the subjective findings, patient said that he had pain in the SI joint, one or both. Orthopedic tests included Yeoman's, Ganslin's, Faber-Patrick. Remember those from chiropractic college? You might have to dust off your ortho neuro books to remember how to do them, or you might remember them. Those are the gold standard tests. You know, I work with some chiropractors where they go, Marty, I don't, you know, I'm more subluxation based. I don't do ortho tests. I don't do neuro tests. I don't own a reflex hammer. I don't check blood pressure. It's a little bit risky, because although you may practice that way, and I respect doctors that practice that way, I don't find anything wrong with it unless you have a problem. For example, if a patient sues you, and a patient can sue you, even a cash patient can sue you for malpractice, and now you're on the witness stand and somebody asks you, hey, Dr. Kotler, how did you come up with this diagnosis? Hopefully, I mean, if you don't say, well, I don't do ortho tests, I don't do any tests, it's not going to look good. You'll probably lose the case. So do a couple of basic gold standard tests, anything to do with the SI joint. Add Yeoman's and Ganslin's, a couple of ortho tests to your exam. It'll help save your butt down the road if there's ever an issue. And then we have the chiropractic findings. There's tenderness in the SI joint, subluxation, hypermobility, hypomobility. You might even want to take x-rays of the SI joint. And then here we go. So that's how you're covering all bases. Patient has pain. You're creating that little breadcrumb trail leading up to the sale of a back brace. Patient said she has pain. You do your ortho test, your chiro test, your neuro tests. Now you come up so you have your symptoms, you have your exam findings, you have your x-rays. So symptoms, exam findings, and x-rays, that leads you to your diagnosis of sacroiliac joint sprain or subluxation, and due to that, you're recommending a lumbar brace or sacroiliac brace. So that's a little breadcrumb trail you should follow. Oh, here's another very common diagnosis, cervical radiculopathy. So if a patient came in and you diagnosed cervical radiculopathy and then you were questioned, you were on the witness stand. So Dr. Kotler, how did you come up with cervical radiculopathy? Well, hopefully you'll say, well, the patient had pain in the neck radiating into an arm, and ortho test, Jackson compression, Valsalva, Sperling. There were diminished reflexes. We checked for myotomal weakness. There was limited motion in the neck, palpatory tenderness, segmental dysfunction, fixation. So that's how you can justify it. Please make sure to justify your ICD-10 codes as best you can. This is a page out of a book. I recommend this book. Has about 25 of the most common diagnosis codes and the ortho, neuro, subjective, and chiro test to support the diagnosis. So if you have a question, you could just go down this list and support it. For example, I just gave you a couple of examples, but there's another one at the bottom of the page, cervical brachial syndrome. Do Wright's, do Atson's, and you'll have forward head posture. Okay, moving along. Oh, now we have something called code pairing. Also very important to pair your codes together, like pairing food and wine. Like red wine goes with meat and white wine with fish and seafood. Well, here's an example. Diagnosis, cervical radiculopathy or lumbar disc degeneration. Well, that pairs beautifully with mechanical traction, 97012. All right, now we're going to get into some back braces. The most common types of HCPCS codes and DME supplies are back braces in the chiropractic setting. And with back braces, you're going to see something called off-the-shelf, prefabricated, and custom-fitted prefabricated. So off-the-shelf are prefabricated items that require minimal adjustments as far as bending and trimming and molding. Custom-fitted is also a prefabricated item that requires substantial modification. So you're going to see those terms a lot in the next few codes as far as prefabricated, off the shelf, and custom fit. So let's go through a few of them. L0625 is a lumbar orthotic, flexible. It goes from L1 to L5, prefabricated, off the shelf. So that's a lower end type of back brace. Much better than the back brace or those, you ever go into, let's say, a CVS or Walgreens, and you see those Velcro straps for about, $40. That's not a DME product. There's no HCPCS code for that, specific HCPCS code. These are specific HCPCS codes for DME devices. And then we have L0627, also a lumbar orthotic, sagittal control with rigid anterior and posterior panels. See, that's another question I get very often. Dr. Kotler, I just bought this lumbar brace from a company. What code should I use? Without knowing the device, without seeing it, without analyzing it, it's hard for me to come up with a code. Now, if you are given a code by a company, make sure they provide you with a PDAC letter. That's the letter that helps prove and justify that the federal government has approved that code. So if you are told by equipment manufacturer, yes, use L0627, and there's no rigid or anterior panels, it doesn't provide sagittal control, then you were given the wrong code. L0628, lumbosacral orthotic. Now this is a very large lumbar brace. It goes from T9 all the way down to the sacrococcygeal junction. L06, and that's a prefabricated off-the-shelf code. L0630 is a lumbosacral orthotic with rigid posterior panels, also from T9 all the way to the sacrococcygeal junction. This is customized to fit A patient by an individual with expertise. Do you have expertise? I would think so. L0631, I think this is the most commonly used billed lumbar brace HCPCS code. That's a lumbosacral orthotic, sagittal control with rigid anterior and posterior panels. Again, all the way from T9 down to the sacrococcygeal junction. It's a custom fit. And then we have L0637, which has more features. It has sagittal and coronal control. So there's more control, there's more pressure put on the spine to reduce any type of injury, decrease pain, support weakened muscles. And I've mentioned this already. You want to contact the carriers you bill and get their policies on billing and coding and documentation prior to submitting the bill. Here's an example. Here's one from Cigna. This is Cigna's policy on back braces. Before you bill, I would recommend you get their policy. If you have a Cigna patient, explain to the patient you're going to bill. If you call to verify and the insurance company says, yes, we cover it, I would still tell the patient the cost, and just in case the insurance company doesn't pay, how much the patient would be responsible for. I'm not a fan of this by telling the patient you're going to bill for the back brace, and then if the insurance company pays, then you're going to tell the patient to come on in and then you'll give it to them. I've heard that. No way. No way, Jose. That does not work. You cannot bill for a service that you don't provide. You cannot bill for a product and tell the patient, you know, just wait and see. If we get paid, then come on and I'll give it to you. No, that's inappropriate. That's like billing an insurance company for 12 chiropractic adjustments before the patient even gets them, and the insurance company pays for all 12, and then you tell the patient, okay, good news, we got paid, come on in. No. I've heard some doctors doing that with orthotics and back braces. No, you cannot pre-bill and then tell the patient what the deal is. That doesn't work. Okay, then we have elbow orthotics, yes. And then we have wrist, hand, finger orthotics. That's L3807. Prolotherapy, chelation therapy, surface EMG. Yes, there is a HCPCS code for surface EMG. Again, most insurance companies will not pay for it, but if a patient needs it to submit maybe to the health savings account, or they just need something to submit to their carrier receipt, then you could actually apply a code to it. A wellness assessment. Here's a good one, S8948, laser. That one gets paid pretty decently. I'd say about 30 to 40% of the insurance companies nowadays do pay for laser, and you could use S8948. Now there's a HCPCS code that's 97039. That's a miscellaneous modality or unlisted modality CPT code. You may be able to use that for laser. But this one's better. I like this one better. It's very specific. S8948, application of a modality, low-level laser. And here's another very common code in chiropractic, S8990. That's the wellness adjustment. You may be able to use that for most insurance companies for a wellness adjustment if for some reason they pay for it. I don't think you would be using it really for an external reason to bill an insurance company, more internal as a cash service, because 99% of the insurance companies do not pay chiropractors for wellness or maintenance care. But there is a code just in case an insurance company will pay for it. A patient needs something to submit. S9090, vertebral axial decompression. There's a decompression code. Spinal decompression is often associated with S9090. Stress management class, S9454. Sales tax. I have a client in the Midwest. His scope of practice requires him to charge sales tax. S999. And T1999, miscellaneous therapeutic items, supplies, retail purchases, not otherwise classified, and you want to put the item, the description in the remarks code in box 19 of the 1500 form. All right, so just a few closing comments. Please check with all the carriers you bill prior to submitting claims based on this information to ensure that's compliant. Target coding does not guarantee the information will guarantee payment from any insurance company or patient. Target coding is not responsible for any insurance carrier or managed care organization laws, rules, guidelines that may change following this presentation. And you know they change all the time. Stay on top of the changes. Attend seminars, webinars. Join your national and state professional associations. Here's our contact information. Email info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. Our HIPAA secure fax number is 1-844-831-2347. All right, we're going to get to questions and answers now. Oh, before we get to questions and answers, the book that I was referring to earlier that had all those diagnosis codes with the ortho-neuro-chiro suggestions and support comes from this book. It's called the book on the best chiropractic ICD-10 and CPT codes to improve reimbursement. Here's another page out of the book. This page, I mentioned earlier the food and wine pairing, so this shows you how you can pair your procedure codes like therapeutic exercises with your diagnosis codes. And here's another excerpt from the book. Yes, this is the clinical tests and findings to support your ICD-10 codes with your ortho-neuro-chiro findings. Another portion of the book, Chapter 2, has the long-term treatment diagnosis codes for every part of the body or the spinal segments, and then the short-term. For example, a patient has sciatica and muscle spasm. Sciatica is a long-term treatment diagnosis code. You want to report those first in a certain hierarchy. This is another page. This is a cheat sheet. There's quite a few quick guides or cheat sheets in the book that shows you the long-term, short-term, moderate-term treatment codes. And then there's a section in Chapter 3 on the frequently asked questions like, what's the difference between a disc disorder and disc displacement? What's the difference between effusion, swelling, edema, difference between spasm and contracture, difference between cervical brachial syndrome and cervical radiculitis, difference between myalgia, myofasciitis, myositis. Oh, we also offer compliance manuals on OIG. This is if you see a Medicare patient. If you see Medicare patients or any patients with federally funded programs, Medicare, Medicaid, TRICARE, you are required to have an OIG compliance plan. Ours is very basic. It's about 35-40 pages. We customize it for you. We give you the main policies and procedures that you're required to have. We give you a chart audit tool. We show you how to get your staff to sign off on these policies and adhere to them. A whole bunch of great forms. Here's a chart audit tool that you are required to do internally. A couple of charts every few months. Oh, we also offer a HIPAA compliance program. HIPAA has become big nowadays because of all the cyber criminal activity and the targeting of small mom and pop offices. So HIPAA has become a big deal now. Make sure you're HIPAA compliant. It's not a suggestion. It's not optional. It's mandatory. If the HIPAA police come knocking on your door because there was a breach or a patient filed a complaint, one of the first things they're going to ask you for is your written policies and procedures, whether you've done a security risk assessment, and if you log your trainings into a log training manual. So we offer that, plus a cloud-based storage portal for all your policies and procedures, and we help you track your business associates. And the HIPAA compliance program also includes the OIG manual. We have a whole bunch of seminars coming up and a whole bunch of webinars. Some are free, like this one. Some you have to pay for, and some give you CE credits. So check our website for our upcoming seminars and webinars. We also offer membership programs. We have a basic membership. It's $99 a month. You could just pay as you go. And we have a gold membership where you get more support. You get ongoing trainings. You get all of our videos and DVDs and CDs and forms and letters and training manuals and access to our seminars for free and webinars for free, and the member-only section of the website, monthly trainings for your staff, and we review your CPT codes and your HCPCS codes and your diagnosis codes. We also have a Platinum membership. This includes comprehensive review plus a full day of training at your office. Yeah, so let us know if you're interested in any of these products or services. We also offer a free coding and compliance evaluation, a free 15-minute call with me or one of my reps just to see how we could help you, or you could just pick our brains for 15 minutes. Again, here's our contact information: email info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. HIPAA secure fax number is 1-844-831-2347. I want to thank everybody for attending. I hope you learned a lot.